New exciting things are happening here at Vernon Memorial Healthcare. The doors are now open to a new state-of-the-art space on the third floor of the Viroqua Area Medical Office Building that houses VMH's Therapy Department. It's an 11,000 square foot space with great views of the city of Viroqua. Really, it's the perfect setting for both patients and staff.
The dream to move out of the basement setting of the hospital has been ongoing for years because of patient need to get to where the location is a little more accessible.
We've had a wonderful department, at one time state-of-the-art space, but really an award-winning staff, but we were located in a remote corner of the hospital in the basement.
We have multiple patients who are doing more than one service on a given day. So the patient is going to be able to go from PT to OT to speech without having to leave our department.
We really try to think of access and the quality of care as well as just the patient experience in designing the whole space. We were at our limit with what we could do in that current space.
We were using places in the hospital for therapy sessions, so using conference rooms and stuff. So by expanding our area, we will be allowed to see patients in a way that's more feasible for them.
It's a big change for the speech pathology patients. We're going to get to be in this state-of-the-art space. We're going to get to have a place to check in and a place for our patients and their family to wait. I think one of the things that this move will do is increase collaboration among myself and occupational therapists and physical therapists.
If a patient is receiving two different disciplines of therapy, those therapists are now going to be able to contact each other one-on-one to talk about that case.
It will automatically facilitate some better communication between staff on the same department, PT or OT, but then also across departments.
You know, if myself and a physical therapist saw that patient in the same day, or physical therapy sees a patient first and there's something going on with that patient that day that's going to impact their treatment, that physical therapist, because I'm right here, can easily grab me and say, hey, just to let you know, John had this happen today, or John is feeling this way, so you're prepared as you go into treatment.
A new space attracts new customers, it attracts new ideas, and things start to flow between people when you're working in the same area.
Again, I think it's going to be a very healthy work environment for our staff, which can only trickle over to the care they provide for our patients as well.
We'll have the secretary's report.
We also are trying our hardest at making the space flow well so a patient can go from service to service without any problems.
There's treatment areas set up for patients who have bariatric needs and also for mobility issues so that they can be seen in the front of the clinic.
The patients that have the most difficulty moving, that we're going to increase their safety by requiring the least amount of movement for them to get to their treatment space where they need to be.
For occupational therapy, this is going to be huge for us. For the first time, we're going to have a spot that's kind of on its own. We're not going to be located in a high traffic area. For those that have seen the therapy department currently, we're located kind of right in the middle of a hallway.
Currently in our area, we have treatment tables in the gym where the patients are exercising. This is going to be kind of nice because it's a combination of, there will be patients coming through maybe walking, but there will be these individual treatment tables and we'll have curtains around them for privacy.
We're providing the private areas so the patient is able to receive treatment, not out in the open, and respecting their privacy as much as possible.
Our pediatric patients won't have to be seen now in an area with the rest of the gym, with the rest of the clients that we see. They'll be able to be seen in the private room now. That's a smaller gym for them.
Right next door is multi-purpose room, another multi-purpose room that actually is going to have some gross motor sensory opportunities, which could have some huge benefits for some pediatric patients. There's research behind moving doing actually both gross motor and fine motor activities along with speech therapy can accelerate the treatment process.
As you see here, we have a zip line for pediatric patients. We also have hooks in the ceiling to do some rope climbing and stuff. So this is an exciting room that we absolutely do not have something like this right now.
This room could also be used for our Lee Silverman voice treatment loud patients. This is another one of our soundproofed rooms. So if the other room is being used for some reason, we could be in here doing our long and loud ahs.
Patients doing those treatments don't have to worry about other people hearing what's going on, because they're making loud noises, they're bumping around, those kind of things.
We've soundproofed these rooms so that they don't have to worry about that, and that we can really maximize our treatment time and that they're putting forth their best effort.
In the new department, we have not only our OT department right here, but we also have a separate area that's a fully working kitchen. So we can bring patients here to work with daily living skills and things necessary for normal functioning at home.
In our previous space, we would have just talked about these things probably, but now with the access being so easy, we'll actually come over here and stand up here at the counter and have the equipment we would need in the kitchen right here.
This is actually our OT area. In this area, we're going to have 3 private hand treatment tables, as well as an area for our hand whirlpool. And a splinting area will be in the corner over here. We're going from 2 hand table areas now to 3, and then an additional table in the corner for other private patient treatment sessions.
It's really helping us with our sports medicine program as far as having more open space for running, throwing. The track is going to have some marks on it to have like a permanent ladder on the floor for agility training for our athletes, and also some marks for some tests that we do with patients for balance and falls prevention.
If you have a therapy appointment, getting to the new therapy department is easier than ever. If you're coming from the north on South Main Street, turn left into the first driveway after you pass South Street. Coming from the south, it'll be the first driveway on the right after you pass West Oak Street. Now once you enter the driveway for general parking, turn into the parking lot on the left, just across the street from the entrance to the Viroqua Area Medical Office Building. Handicap parking is also available in that lot and also across the driveway next to the medical office building. Additional handicap parking is available just past the entrance to the medical office building on the left-hand side. Once you're parked, enter the medical office building using the revolving doors or the doors to the side. Then you'll see the elevators to your right. You'll take those elevators to the 3rd floor where the therapy reception staff can help you check in.
Patients who use aquatic therapy will be using the wellness center to come through to enter the pool. The wellness center is planning just to make sure that the patient has an appointment in the pool. All the appointment calls and scheduling and payment for anything is coming still through the therapy department. So they're really just going there to enter the pool. We are taking care of all the scheduling still.
There isn't a service we can't offer here that is being offered anywhere else in the area. This is really, making us more or less a center of excellence in multiple areas, and, kind of a one-stop shop for your therapy without having to travel.
We have highly skilled therapists here with certifications in different areas, and those people are all here and working, and we're really, I think it's just going to enhance everyone, the workers and the patient's experience.
You know, our patient care has never been doubted in the past, and we've always provided great service, but this new space provides us with new opportunities.
The current staff that we have in place are all so adventurous enough that if we see a need in the community, something we're not currently offering, they'll find a way to provide that, whether it's additional education, if it's additional equipment, which we couldn't add before because we had a shortage of space. Now we can provide those moving forward. The PTOT speech staff that have been involved with the design from day one, great suggestions, has really been exciting to be a part of, and it's going to be second to none in this area, I'm certain.